Hi, Figs. My name is Georgiana, and I am a registered nurse. I've been a registered nurse for the past 6 years. I work at a mental health hospital. I've also worked there for the past 6 years. Basically, mental health nurse has been my passion, has been my calling. I believe fate led me there because I don't know how all of a sudden I applied for a job. The only place that hired me is mental department. After I graduated from school, a lot of people told me that it's going to be hard to get a job as your first job at a mental health hospital. A lot of people told me that. So I've already had my hopes up that getting a job working at a mental health hospital as a first job would be very hard to get. So how I was able to get it, I don't know. But I love everything about it. It's amazing. It is rewarding. It is rewarding to be able to know that you've helped one or two people. You've helped them with their emotions, with how they're feelings, with letting them know that they're not, they're not alone, that someone actually does care, which I do care. Where am I from? I am from Nigeria. I was born in Nigeria. I was born there. I came here 1998, and I live in Fresno, California. I've lived here for the past 5 years now. Before then, I lived in Los Angeles. And I go to school. Right now I'm currently studying postmaster psych nurse practitioner at National University, and my anticipated graduation date is June of 2021, and I am excited. I am so excited. Why did I decide to do psych nurse practitioner versus the other FNP? The reason why I decided to do it is, first, like I mentioned earlier, I believe that being in psych is my calling. I just know that this is my passion. This is where I need to be, you know? So I've worked with a lot of psychiatrists. I've worked with a lot of nurse practitioners, including my patients. A lot of them have motivated me, have talked to me, have asked me to go further with this. Why did I wait 6 years? I am not sure. I think I waited too long. But there's a reason. I'm sure there's a reason to that. And my reasons is the finances part of it. Then I wasn't ready financially, but even now, I'm not ready financially. But I believe that with your help, with any type of grant, I'll be able to get it. I'll be able to finish. Why did I decide to go further with this? I decided to go further with this because as I was working with my psych patients, a lot of them have asked me, are you sure you're not a nurse practitioner? Are you sure you're not a psychiatric? And I would tell them, no, I'm not. So a lot of them will have, talked and said, well, you relate to us as if you were. But I'll tell them no, but I am planning on pursuing my degree in that. So a lot of them will tell me, well, you should hurry up. You should go ahead and do it. So that's what gave me that courage to, go ahead and pursue it. So what do I want to do in the next 5-10 years? My plan is to open up my own clinic, to open up my own practice. I have worked a lot with VA patients, meaning patients that have served the Army, patients that, because they served the Army, they've developed PTSD and some other mental illnesses. I've worked with many of these patients. I've worked with a lot of underserved patients that, many people looked at mental health as a stigma. A lot of people see it as a stigma. My job is to let people know that it is not a stigma. It is not a sin to have mental issues. Mental issues, it's okay to, people have it. It's not there's nothing wrong with it. A lot of people who have it, all they need is some kind of encouragement, some kind of a support group, some kind of therapy, medications to be able to overcome that. But most people don't know. Most people are afraid to speak up that they have psych issues, depression, schizophrenia. A lot of people are sick because they believe that they're not going to be accepted